David A. Scott, President of ANZCA, joins us now. Thanks for joining us, David.
Hi Tanya, it's a pleasure.
So first of all, the ASM this year, what's shaping up?
This is a great venue, obviously, in Sydney, and the excitement about the ASM is really palpable. There's well over 2,000, probably closer to 2,500 delegates this year, and looks like to be the biggest attendance we've had. And I think that reflects the quality of the program. We've got a terrific scientific program, we've got lots of workshops, people love workshops. We're here collaborating with the College of Surgeons. We spend every day collaborating with them in the operating room, and here we are at a conference also meeting together, sharing some sessions, and just being able to socialise and network as well. And one of the best things about a conference like this is the opportunity to network, to catch up with friends and colleagues that you wouldn't otherwise meet on a regular basis, and to share ideas. It's both a social but a strong learning experience.
Now, this week is your last week as President. How do you see the college tracking at the moment?
Well, obviously I've got to say the college is tracking well, and it is. I'm very, very happy with the way the college has progressed over the last decade, and the last 2 years has been one of a lot of activity in the college. The college is based on a really strong and expert staff and a lot of enthusiastic fellows. And the end result is what we've got now which is a progressive education training program. We've expanded on a number of activities over the last 2 years, which I can talk about, and we've grown new initiatives in a number of areas, and that's all for the betterment of training and helping our fellows to keep educated and supporting them. But also we're moving into different new areas now of health and well-being for our trainees and our fellows, and that's something which I think is critically important in the 21st century.
What are some of the other things that have progressed over the last 2 years?
Over the last 2 years, I think some things that have really strengthened our engagement and collaboration. So engagement both internationally and locally. We've formed great alliances now with the College of Anaesthetists of Ireland, the Royal College of Anaesthetists in the UK, as well as what we call our Tri-Nation Alliance, which is with the Royal College of Physicians and Surgeons of Canada. So in the broader global sense, we're also reaching out into China, the Chinese Society. But we're really strengthening our regional partners as well. So we're working closely with the Hong Kong College. We've signed an MOU with them. And we're working closely with the Malaysian College, and we're having discussions about how to help them. And so we're really trying to reach out externally. Overseas aid, we're supporting Papua New Guinea. We have a scholarship participant at the conference this year, which is fantastic. And then internally, we're working well with our societies, closely with our societies, in fact closer than I think we've ever done with the societies, and the other colleges in the region as well. We've got building important relationships which are necessary as we develop things like perioperative medicine and rural anaesthesia practice. So we need to be able to collaborate with those colleges, and I think we're moving very well in those areas. The other area that I think we've progressed is research, in particular starting to engage junior researchers and new researchers into the field. We've set up strategies now which I think will help support them, and will continue to grow them, because ANZCA's research is internationally regarded as being one of the best in the world in anaesthesiology, and I think we need to make sure that our younger researchers are up and coming and prepared to carry the baton, if you like.
We've got new President Dr. Rodney Mitchell joining at the end of this week. What are your thoughts on him? With that?
Look, Rod's a great guy. He's incredibly experienced. He's got experience in rural, urban, metropolitan anaesthesia. He's got experience in intensive care. He brings a strong background to the role. And I think he'll be a great leader of a college over the next 2 years, and he'll be supported well by Vanessa Beavis, who is the incoming Vice President, and she's a senior anaesthetist experienced in a number of aspects of clinical care and management from Auckland. So it's good for the college, because I think one of the challenges the college has got over the next few years is increasing diversity, and so I think both Rod and Vanessa will be able to support the growth in diversity within the college.
And finally, there's a bit of debate over naming going on at the moment. Anaesthesia or anaesthesiology?
Well, I think I've made it clear that my vote is for anaesthesiology for all the right reasons, and that we're now a grown-up specialty. We don't just sit in a room delivering anaesthesia care. we care for a patient throughout, preoperatively, intraoperatively and postoperatively, expertly. We should be described for what we do, which is anesthesiology.